So, my dear students, I hope you'll have been doing well. I'm Dr. Qurat-ul-Ain and we are studying a pharmacology course. This is my lecture number 3, and in this lecture we are going to study about the pharmacokinetics of a drug, that is how drug distribute among the different body compartment. So in my previous lecture, we have been studied about the basic pharmacology. What is the drug? What are different dosage form? What are the different type of doses? What are the different type of route of drug administration? And what is the difference between when we inject a drug via antral route or the parenteral route? And what is the difference between the systemic and the portal circulation? And how the drug efficacy would be affected when we inject a drug via oral route or we administer a drug via the when we administer a drug via the oral route or injecting a drug via the parenteral route. So we have already all these discussed during our lecture number 1, and in lecture number 2 we discuss about the pharmacokinetics of a drug, and we discuss how drug absorb and what factors that affects on the drug absorption, and what is the basic phenomena of drug absorption. Now in this lecture, that is the lecture number 3, we are going to study about the second step of pharmacokinetics of a drug, that is the drug distribution. So what is the to understand this drug distribution, first of all we have to recall about what was the drug absorption. So drug absorption was the phenomena or the mechanism in that we administer a drug. When we administer a drug at the site of administration, from that site of administration drug travel into the blood. So this is the drug absorption. So now in the drug distribution we have to understand that how drug distribute from this blood vessel. From there it is absorbed and reach after the administration on the site of administration, and how this drug distribute from this site of absorption to the other compartment of the body. So what is the distribution? Actually, distribution is a process in that drug reversibly leaves the blood compartment and enter into the extracellular fluid or in the cells and the tissues of the body. So this process is a reversible process. What does it mean? It means that drug may leave the blood compartment and enter into the extracellular fluid and in the cells and the tissues of the body, or drug may revert back again towards that previous compartment, that was the blood compartment. So this was the blood drug distribution, and now we have to understand that in what compartment of the body drug can be distributed. So we are having three main compartment in our body, that is the plasma compartment, that is the 6% of total body mass, and the second compartment is the extracellular fluid, that is the 20% of the total body mass, and the third compartment, that is the biggest compartment of our body, is the water compartment. So drug can be distributed only into one or all three compartments of the body after its absorption into the bloodstream. What is the now here is a term, that is the apparent volume of distribution. So what is the apparent volume of distribution? Apparent volume of distribution, actually the apparent amount of distributed drug or the quantity of the apparently distributed drug into the different body compartment, and we can calculate this apparent volume of distribution by dividing the total amount of the drug that is distributed into the body with the concentration of the drug that would be distributed in the plasma. So now we would be discussing that how drug distribution could be affected by different factors. So there are several factors that affect on the drug distribution, and most important factor is the drug protein binding. So what is the drug protein binding? When the drug absorb from the absorption site, absorb from the administration site into the blood, and drug comes in the blood. So what happened? There are different type of protein that remain in the blood, and drug may bind with them. And the one of the most important protein, that is the albumin, it is the most important protein. With that, almost 20% drug can be bind. So what happen if the drug bind with the protein? So when the drug bind with the protein, what happened? That less amount of drug, free drug, would be available to uh, to penetrate, to travel from the to pass from the blood capillary and enter into the ECF, and from there enter into the cells of the body and the tissues of the body, and reaches to the target site. So what is the target of a drug? Target is also another type of a protein that we say as a receptor. So what happened when greater amount of a drug uh, would be able to bind with non-specific protein in the blood, that is like albumin. So what happened then? That less amount of a free drug would be available to reach to the specific target protein, or specific type of a protein at the target site. So in this case, the drug would be having its um, less efficacy, or less me- less mechan lesser effect. So this was the most important factor uh, by this that is considered to be to for the to hinder with the drug distribution. So in the case when then a lot of amount of a drug would be bind with the non-specific plasma protein like albumin in the blood, so less amount of a drug would be available to distribute among the different body compartments. So the other factor that supposed to affect the distribution of the drug into the different body compartment is the capillary blood flow. So if the blood flow would be lesser, so in this case the lesser amount of a drug would be available to reach to the different body compartment, and there would be less distribution of the drug. And one of the other important factor that affect the drug distribution is the capillary permeability. If the drug would not be highly permeable, and would not, so in this case the lesser amount of drug would be able to penetrate and pass on from the capillary of the plasma membrane, and the less amount of a drug would be able to reach into the ECF, and it would be able to reach in the cells, and then in the tissues of the body. And then the drug distribution would also be affected by the structure of a drug. For example, if drug would be highly lipophilic, so what happened that uh, um, high amount of a drug would be easily penetrate from the plasma membrane. However, if the drug would be hydrophobic, then the less amount of a drug would be able to penetrate or transfer from the blood capillary to the extracellular fluid and into the cells and into the tissues of the body. So these all are important factors that affect the drug distribution. So in conclusion, whatever we have been studied in our lecture, we studied about the drug distribution. That is one of the second step of the drug pharmacokinetics. So what is the drug distribution? The drug distribution is a process by which drug reversibly leave the bloodstream and enter into the interstitium, that is ECF, and or the cells and the tissues of the body, And what is the apparent volume of distribution? The apparent volume of distribution is the apparent amount or the quantity of the drug that is apparently found to be distributed into the different body compartment. Drug distribution could be affected by drug protein binding, the capillary blood flow, capillary permeability, drug nature, that is the lipophilicity and hydrophobicity of the drug. And then if drug mostly bind with the protein. So this was a whole about my lecture number 3. And thank you very much for your kind attention. And now in the coming lecture, that was the lecture number 4, we are going to study about the drug metabolism. And it is very interesting and very informative lecture. That would be lecture number 4. And if someone willing to have my hard copy of my lecture, so they can write me an email. The hard copy of the lecture would be provided you on request. So thank you very much for your kind attention, and see you again tomorrow. Allah Hafiz.